where Japan is seeing a sharp rise in seasonal flu cases, with its health ministry reporting a record surge at the end of December. Authorities also urging residents to take greater precautions as the increase puts a strain on medical supplies and even hospitals. SABC News reporter Rebecca Bundhun has more from Tokyo.
Public health officials say that more than 300,000 flu cases across some 5,000 institutions were reported in the week to the 29th of December. That's up from about 100,000 a week earlier. And with an average of about 64 cases per clinic, that's the highest level since the Health Ministry's records began in 1999. And numbers have been rising across Japan. In many parts of the country, schools have been forced to cancel classes or fully shut down amid warnings. Authorities blame the rapid spread of flu on people travelling and gathering during the holiday season. Doctors also say that people's immune systems have been weakened because there hasn't been a major flu outbreak for a while, and that's partly due to COVID-19 restrictions that were put in place during the pandemic. And a couple of major drug makers have announced that they have been forced to temporarily suspend supplies of some of their flu medicine because of surging demand. Almost 12,000 flu patients had to be hospitalized between September and December. And Japan's health ministry is urging people to wear masks and to wash their hands to prevent infections. Rebecca Bundhun, SABC News, Tokyo.
All right, to weigh more on this, let's now welcome Professor Tulio de Oliveira, who is the director of the Center for Epidemic Response and Innovation, or CERI, and KwaZulu-Natal's Research, Innovation and Sequencing. Prof, always grateful for your time. Compliments to you. So the fears of the outbreak in China or Japan jumping all the way to our shores now, threatening another lockdown. But should we really be scared at this stage? The NICD locally has not raised any alarm.
Okay. Yeah. First, it's very good to see you again, and just wishing you a good start of the year for all your viewers. Yeah, and the answer is quite simple. We have nothing to be concerned at the moment in South Africa. Not only we do not see the same signal of very fast increase of respiratory infections, but also we are in our summer months, whereas for example, in the Northern Hemisphere, and we are talking about countries with a severe winter, like Japan, China, the United Kingdom, they are in the middle of the yearly respiratory outbreaks that happen not only in the winter season, but that's follow the festive season. So the case that we are seeing in these three countries, for example, is quite normal, and I don't think that's any problem to South Africa. And to the best of our knowledge, when we talk with colleagues in these three countries in the Northern Hemisphere, they say that they have a severe winter flu season, but not much more severe than they have seen before. And they think that the peak is to pass very soon.
But Prof, I mean, the symptoms that are currently being described in China or Japan of the HMPV is what they've termed it, have also been likened to those very similar to COVID-19. But does this not mean that if you are then suddenly, or does it mean that if you're suddenly experiencing fever or chills or presenting similar symptoms, you could be infected? And is there any direct and established medical link between HMPV as well as COVID?
Thank you for the question. So just to clarify, the HMPV, what's called the human metapneumovirus, it is not a very severe virus, and it's a virus that have been circulating around the world for decades, including in South Africa. So we do have population immune to that, and in the great majority of people, it is just one of the virus that's part of that causes cold. So it's not associated with COVID. It's normally close associated with another virus that we call respiratory syncytial virus, or RSV, normally affect young children, but normally the symptoms are not very extreme. What we have to do in South Africa, now that we finish our festive season, and we are going back to school, is mostly use common sense. If someone develops some respiratory infection, try not to pass to too many other people. So if a child is with runny nose or with a cough, to keep at home instead of sending to a school setting, and just trying to avoid a large outbreak. But normally, large outbreaks of respiratory pathogens, especially the ones that is well known and that we have immunity, like HMPV, COVID, influenza, and RSV, they don't tend to be severe in the summer months, and we have nothing to fear at the moment in South Africa.
And thank you for allaying those fears, Professor, because a lot of people within asking if they need to quickly go and get any medication. So how would you then medically categorize the current breakout in China? I hear you saying it's a virus or a respiratory disease that is associated with the winter months. I also understand that here in the country, we do have some vaccines that is currently that we currently have here in this country to prevent against what is currently happening in China and Japan. So could one then go for a COVID vaccine to try and ensure that they don't get infected with the HMPV?
Okay, thank for that question. So HMPV or human metapneumovirus, it is that there was no vaccine exists to this virus, but normally and do not cause strong symptoms. And we already have population immunity. For people that have advanced age or comorbidities and worried about themselves, especially before our winter wave, the big suggestion that we have is should they take the flu vaccine, which start being available now, especially before the winter wave. The flu wave in South Africa only normally start around June, July. So it would be good that people that advanced age or immune compromised or with chronic disease to think about getting the influenza vaccination. That's the suggestion that we have at the moment. We're also not very worried about COVID in South Africa. We have very high population immunity from previous infection and vaccination. And the one that we worry a little bit more for the winter is the flu. But normally the flu season in South Africa is not as extreme as the northern global north countries. They have a much more severe winter than us, and they also follow the winter after the festive season, where there is a lot of mixing.
All right. And a very quick one, Prof. I mean, we always await and expect that the relevant health authorities and bodies such as yourselves will be the first call to raise the alarm should there be any panic. So at which stage should, then South Africans or citizens expect an alarm to be raised around the crisis so that they need to take precautionary measures?
So South Africa has one of the most advanced surveillance system for pathogens in the world. That became quite clear on the COVID program. So in addition to that, we have very strong organizations, scientific organizations like us, the Center for Epidemic Response and Innovation, and CRISP, at the Nelson Mandela School of Medicine. We work together with the NICD to track pathogens. We are also in what we call the Ministerial Advisory Committee that advise direct to our minister and presidents. And our main advice now, both for the public health and for the public, is that there is no reason to concern. We can just keep going with our normal life, just use some common sense if someone get a cold. And if something change, we will highlight, but we don't see anything change in the near future for South Africa. And what we expect is in the next 2 or 3 weeks that this wave of infection in the northern counties starting decreasing. They normally start coming down from the second week of the year. So that's what we expect to happen in the next few weeks.
Good news from you, Professor. Thank you so much for that update. Professor Tulio de Oliveira there on the growing concerns of the HMPV breakout that is currently happening in China. He says here in South Africa, we do not need to worry.